Have you ever wondered how much money a doctor makes? Well, today you're gonna find out. There's a video I saw from Dr. Mike where he interviewed a bunch of doctors and asked them how much money they make. I'm nosy as hell, so I really want to find out. But before I share that video with you guys and give you guys my comments, please take the time to hit the like and subscribe. I'm trying to get to 1,000 subscribers and I want my kids to think I'm really cool. And with your help, I could certainly get there. Thanks, guys.
I asked 20 doctors to tell me how much money they make in a year.
My name is Ricky Brown and I am a board-certified plastic surgeon in Scottsdale, Arizona. How much money do I make? I make enough money to buy 333,333 Happy Meals. You do the math. Oh, good.
Okay, now I just have to do it. I just have to find out. So let me see what I got here. So a Happy Meal is $2.99, right? Happy Meal is $2.99. And times 333,333. So it comes up to $996,665. And I don't know if he's including taxes or not, but still, that's a lot of money.
When I was doing full-time clinical practice, my base rate was about $400 an hour. The cool thing is that earning $400 an hour allowed me to do things like see a ton of patients or clients for free. And at one point, half of my practice, I actually wasn't charging a single penny. I could still support my family of 4 without really too much trouble. The other really awesome thing about people in my specialty is that we tend to work pretty light and easy hours. The average mental health professional actually does about 30 to 32 hours of clinical care per week, which means that our job is pretty like low stress.
Wow, that is pretty cool and pretty interesting type of field to get into. I mean, $400 an hour is a lot. Man, in 10 hours he's making $4 grand. And he say he works 30 hours, so 30 to 35 hours a week, so that's $12,000 a week. And the cool thing about it all is, listen, I know everyone's gonna look at this video and say, they make so much money, why do they make so much money? But it's pretty cool though, in the same time, he said he's doing things for free. So he's able to help some people for free. He doesn't need to charge them because he does get paid so much per hour that it gives him the flexibility to just say, hey, you know what? You really need the help. You have the funds. I got you. And it also what's cool about it as well is he knows he makes so much money an hour that now he can spend time with his kids. So that is a pretty cool gig to have. I'm pretty sure the student loans, man, to try to get in his field is probably really, really, really high.
Hi, my name is Dr. Antonio Webb. I'm an orthopedic spine surgeon here in San Antonio, Texas. So how much do spine surgeons make? It varies by practice type. A private practice spine surgeon in the South can expect to make, once you build a mature practice, which takes anywhere between 3 to 6 years to build, can expect to make 7 figures.
Now, I've seen him before. I seen him before on a YouTube video, and I actually did a reaction video on that same guy where he was just going out there and he was talking about how he just got debt free. He started running around the office. He was super duper excited that finally, even showed the payment, he paid off all his student loans. That was a really good motivational video because, as you know, doctors and the amount of student loans they have are extremely high. So the fact that he was able to tackle that and knock it out, and now making close to $1 million a year if they had their own practice, that is pretty sweet.
I'm Dr. Danielle Jones. Some of you may know me as MDJ, and I am an OBGYN. That means I take care of anything having to do with periods, pregnancy, and the female reproductive tract. How much money you make as an OB/GYN doctor varies widely by where you practice and what kind of practice you're in. I currently work in Aotearoa, New Zealand, which is a public health system, and a full-time ONG specialist who's been out of training for 6 years, like myself, would make around $130,000 US in this system, which is significantly less than one would make at the same level in the US or even in Australia.
That is extremely less, but she must really like what she's doing and she feels like she could get better enjoyment in life working out in New Zealand. I think she said New Zealand. Yeah, in New Zealand. That is a lot less, but I mean, $130,000 living in New Zealand is probably a whole lot of money. And the lifestyle she's living over there is probably way better. Now, I'm starting to notice a trend. The last video I saw the guy, he had a YouTube channel. That's how I discovered him. She had the plaque in the background. It seems like, and that's really genius, that they actually are YouTubers as well. And some look like they become TikTokers or whatever. But her specifically, she had a silver play button, which means she has over 100,000 subscribers on her channel. I need one of those back there really soon.
Hi, my name is Dr. Winters, aka The Dentist Online, and I'm an orthodontist. I'm gonna be real with you. An orthodontist can make $250,000 starting out as an associate, anywhere up to about $350,000. And then if you own your own office, you can make anywhere from $500,000 up to $3 or $4 million, and even upwards if you own multiple practices. Crazy, I know.
These guys are really cheesy though, right? They're kind of like energetic. It felt like I'm watching like The Price is Right or something. I don't know, like an infomercial, because these guys, they they know how to talk, and you can imagine so, right? In their field, they have to sell the patient to why they need these certain type of treatments or some type of cosmetic work or whatever the case may be. And this guy, he seems like he just fits like the perfect picture of a salesman. And once again, you see in the background a silver play button. It seems like a lot of people in the medical field, they love doing YouTube, and why not? There's an extreme fascination for people to know how much money they make, what they do, what's like the day-to-day life of being a doctor, how they became a doctor. People are extremely fascinated by their stories. So by all means, go ahead, right? That is just smart. Make videos on the side, and there's a possibility they probably make so much money on YouTube. It's not even a supplement to what their primary jobs are. They probably make enough money on YouTube where they really don't need to be doctors anymore. That's really smart and that's really genius.
My name is Dr. Sanjay Juneja. I'm a hematologist and medical oncologist, basically specializing in blood disorders as well as cancers and how to treat them. As a medical oncologist, depending on what system you're in, some private practices get paid for literally the things they prescribe and how much they cost, versus other systems where you get paid just for what you see regardless of treatment. I like the latter because it kind of keeps you clean from thinking about cost as it relates to treating patients with cancer, and generally those don't pay as much, likely somewhere between $400,000 to $500,000 depending on where you are in the country.
Now, I never knew there was two types of systems. One is pretty much like a base pay, right? And one is you get based upon what you prescribe. That is really borderline unethical to some people, because it's like, you know, you're prescribing this to me because you're gonna get more money, or you're looking out for my own well-being, or you're doing your own. So that's why it's pretty cool that he's like, you know what, I avoid that, because man, if I was in that position, I would find that really difficult as well, to just try to become like, to know, are you doing this because it's the best interest for yourself or for the patient, and the patient might feel a certain way about it if they find out. So it's like, just avoid all that, just to be able to sleep at night with a clear head, and then just do like the base, which is what he does. And listen, up to $500,000, that's a lot of money, but you can only imagine how much they make in the other model where you get paid per course.
What up, my name is Dr. John Patton, Doc JP3, and I'm a board certified anesthesiologist and a regional anesthesia and acute pain medicine specialist. Sometimes people hear of the E road to success or road to success. The E road to success is thought to be the subspecialties that allow for you to have a better lifestyle. You may be able to take no call or spend more time outside of the hospital with your friends and family. When we are in residency, when you factor in the hours that we work and the amount that we're making, it comes out to be less than minimum wage. So now that I'm done with training, I will say that it's really nice to finally be able to make a good living and be able to start thinking about paying back loans, the bane of my existence. Yes, they're still there. Being able to save for a down payment for a house, which is something that my wife and I have been wanting to do for a while. And now that we have a son, being able to put some money aside and, you know, for his college and whatnot. So that's how I answer that question.
I like the fact that these guys are just being upfront and they're just being honest about the situation with him as well, still saying they have student loan debt. In order to become a doctor, you gotta have probably a massive amount of student loan debt. I don't know anyone who would just pay for like medical school out the pocket. It just seems extremely expensive, but if you really like what you're doing and you like that journey, then it's worth it. To me, it's worth it. Scary as hell though, because you're banking on yourself, because hey, it's never a guarantee you go to medical school and you pass. There's probably so many stories out there, people gone to medical school and something happened in their life where they had to, you know, stop attending, but the student loans guys don't disappear. They remain there. And that's the part that's really unfortunate. But overall, this video was really interesting. And now I see the fascination why people love to hear the stories about doctors, how much money they make in their journey. Because most people see a doctor as they just get paid a lot, but they don't understand what they have to go through, how much debt, how much education they have to go through in order to get to the point to where they are today. Thank you guys for sticking around to the end of this video. I'm on to look for a next video to react to, but at the same time, please hit the subscribe and the like, and catch you guys on my next one. Peace.